Welcome to our discussion of metabolic mayhem, where we'll walk through the key challenges of metabolic disorders and why they matter for patients and health systems alike. Over the next slides, I'll summarize prevalence, mechanisms, diagnostics, and emerging therapies to paint a practical picture of where the field stands and where it's headed. Metabolic disorders impose a major global burden. Roughly 537 million adults live with diabetes, and about 1 billion people are affected by fatty liver conditions, driving nearly $800 billion in complication. Related costs annually. Common complications like renal failure, cardiovascular events, and neuropathy highlight a need to scale early detection and lifestyle interventions that remain underutilized. To understand disease progression, start with normal insulin action that keeps hepatic glucose output and peripheral uptake balanced. When insulin resistance develops, lipolysis and free fatty acids rise, peripheral hormonal uptake falls, and hepatic glucose output increases, creating a self-reinforcing cycle that ultimately impairs beta cell function and leads to type 2 diabetes. Excess calorie intake fuels hepatic de novo lipogenesis, and VLDL production, promoting adipose and ectopic organ fat deposition. Impaired fatty acid oxidation drives lipotoxicity and mitochondrial stress, which in turn trigger inflammatory cytokines, accelerate insulin resistance, and contribute to atherosclerotic plaque formation and systemic dysfunction. Type 2 diabetes stems from progressive insulin resistance and beta cell failure, producing symptoms like polyuria, fatigue, and blurred vision. Chronically elevated glucose injures microvasculature, leading to retinopathy, nephropathy, and neuropathy. And while lifestyle change and glycemic therapies reduce risk, residual complications often persist. Non-alcoholic fatty liver disease ranges from benign steatosis, often reversible with modest weight loss, to NASH with ballooning, inflammation, and fibrosis, and in a subset progressing to cirrhosis or hepatocellular carcinoma. Roughly 20% progress beyond simple fat accumulation. And today, a clear therapeutic gap exists with no universally approved pharmacotherapy. Assessing metabolic risk uses established markers like HbA1c for 3-month glycemia and LDL, and triglycerides for lipid risk, alongside liver enzymes, ALT and AST, and metabolic syndrome signals, such as uric acid. Emerging markers of mitochondrial stress, like adiponectin and FGF21, offer early warning potential to guide timely intervention before irreversible organ damage. Advanced diagnostics are expanding precision phenotyping. MRI-PDFF quantifies hepatic fat non-invasively and enables longitudinal tracking without biopsy, while PT tracers reveal tissue-specific metabolic activity, such as brown fat or myocardial glucose uptake. Together, these tools enhance subject stratification, monitor therapy response, and provide deeper insight beyond blood tests. GLP-1 receptor agonists work by suppressing appetite and improving insulin sensitivity, delivering meaningful outcomes like improved glycemia, roughly 15% weight loss on average, and fewer cardiovascular events. Practical advantages include weekly dosing to boost adherence, while adoption faces hurdles from gastrointestinal side effects and high costs, motivating next-generation delivery and generic strategies. New modalities aim for durable metabolic correction. AAV vector gene therapies target the liver and gut for long-term glycemic control. CRISPR base editing modifies lipid metabolism genes to reduce lifelong LDL. And mitochondrial replacement seeks to restore cellular energy in inherited defects. Each approach targets specific tissues with aims ranging from improved glycemic control to permanent cardiovascular risk reduction. Population metabolic health depends on diet, activity, and supportive policy. Dietary patterns rich in fiber and unsaturated fats while avoiding ultra-processed foods can lower diabetes risk by about 30%. Moderate exercise boosts mitochondrial capacity and insulin sensitivity within days. And policy changes like sugar taxes and active transport design can amplify these individual benefits at scale. Bringing it together, integrating genomics, the microbiome, and continuous metabolomics enables patient-specific risk profiles and targeted therapy selection. AI-driven digital twins can translate multi-omic data into individualized plans that maximize adherence, optimize metabolic outcomes, and minimize adverse effects and long-term healthcare costs.